2020 census count, which wraps up September 30th, only 28 days away. Every 10 years in this country, we count the number of people who live in this state, and based upon that number, the federal government gives our state funding for schools and hospitals and roads and childcare and more. And the higher the count, the more of your federal tax money comes to Illinois instead of going to other states, and the more representatives we get in Congress. Today, when Illinoisans pay our federal taxes, we're one of only 10 states that gets back less than we pay to the federal government. We can do so much better. And all of you can help by simply getting counted in the census. We're competing against all the other states, and we're doing very well so far. But we can't rest on our laurels. Right now, we are number 1 among the most populous states and number 6 overall in our response rate to the census. But there are still many neighborhoods in Chicago and towns and cities and counties all across the state that are falling behind, hovering between 30 and 50% participation. These areas include some of our most marginalized and hard to count communities, places like Austin and Little Village neighborhoods, and those are just in Chicago, then Dixmoor, Harvey in suburban Cook County, and parts of Metro East and Central and Southern Illinois. Many of these same communities have also been disproportionately impacted by COVID-19, and the pandemic has limited traditional census community outreach, such as neighborhood events and old-fashioned face-to-face knocking on doors. But if you have a cell phone, you can get counted right now. It's just a few questions, it takes less than 10 minutes, and it's frankly more important than ever before. It will bring more investment, better schools, better roads, and better health care into your community and to you and your family. Remember, we have only 28 days left to get it right for the next 10 years until 2030. Pick up your cell phone right now and go to my2020census.gov. That's my2020census.gov. Or you can call 1-844-330-2020. Take the time now to be counted. Now to our COVID-19 update. I'm joined today by Dr. Amal Tokars, Assistant Director at IDPH, by Dr. Susan Bliesdale, Medical Director of Infection Control and Chief Quality Officer of the University of Illinois Hospitals and Health Sciences System, and Dr. Nicholas Sulakis, an epidemiological surveillance specialist at Northwestern University's Feinberg School of Medicine. 2 weeks ago today, August 19th, stricter mitigation requirements took effect in the Metro East region, which had surpassed an 8% average positivity rate for 3 days in a row. Unfortunately, that region continues to see positivity rates of over 8%, with the current 7-day rolling average sitting at 9.6%. So as I made clear last week, as of today, Metro East, Region 4 of our Restore Illinois plan will operate under stricter mitigations, the same restrictions that Region 7, that's Will and Kankakee counties, has faced since the middle of last week. These stricter mitigations, as recommended by our doctors at IDPH, include the closure of all indoor bar service, that's indoor bar service, and indoor dining service, the closing of all outdoor bars and restaurants, gaming facilities, and casinos by 11 p.m., a pause on any party bus services, and a new limit on gatherings to the lesser of 25 individuals or 25% of overall room capacity. Let me be clear, these are not decisions that I make lightly. Nor would I impose these restrictions if there wasn't evidence of increasing spread of the virus in these areas. I want our businesses to be open, and I want our hospitality scene to thrive. I want to get people back to work and finding new opportunities for themselves and their families. But the greatest hindrance to restoring our nation's economic vitality is the virus. Until we get it under control, either by people following the doctor-recommended mitigations or with an effective treatment or a vaccine, we are going to be fighting for our economic recovery with one hand tied behind our back. We must slow the rate of infection all across our state. There are virus deniers whose arguments have swung wildly between this is a media hoax and it's just a problem for old people. Now their argument has changed. Their new argument is it's just new cases that are rising, not deaths, and the hospitals are fine, so we don't have to worry. Well, as the White House's own Dr. Birx said yesterday, Florida, Texas, Arizona, and other southern Sunbelt states thought that their increasing infection rates were unimportant. And then, in no time at all, their hospitals were overrun. When that happens, a lot more people die. I won't let that happen here. And let me remind you that people are dying every day from this horrible virus, and thousands who've recovered are still suffering from life-threatening pulmonary and cardiac symptoms. As Dr. Ezike and I have said throughout this COVID-19 pandemic, facts and science will continue to determine what efforts Illinois should make to protect our people. If the data shows that the virus is spreading at a high rate, we won't hesitate to take action to protect the people of Illinois. Your health and safety is my paramount consideration. How each region is doing is available every day on the IDPH website. But I want to highlight that what's going on across the state, that over the last 2 weeks, 9 of our 11 regions in Illinois have continued to see their positivity rates creep upward, with 4 seeing more than 1 full percentage point increase in positivity rate. Only 2 regions have seen an actual reduction in that same period. That's the West Central region, that's Region 3, which stretches from Quincy across to Springfield, and the East Central Region 6, home to Urbana-Champaign, to Decatur and Effingham. We continue to closely monitor every region. So I want to emphasize again that local elected officials and health officials should pay close attention to the data for their communities and, where necessary, step up and impose greater mitigations on a targeted basis to bring down the number of infections and the positivity rate. It's time to mask up, Illinois. If we all do our parts, masks, distance, hand washing, getting tested, we can get through this and we can come out stronger on the other side. Lastly, I'd like to invite all Illinoisans to join me and multiple faith leaders in a virtual memorial service tomorrow night that honors those who have lost their lives to COVID-19. You'll be able to tune in to our live stream on social media starting at around 6:30 p.m., and I'd be honored to have you join us. So thank you, and with that, I'd like to turn it over to Dr. Amal Tokars, Assistant Director at IDPH, for today's medical update.
Thank you kindly, Governor Pritzker. I'm going to say just a few words that will affirm what the governor has just said to you. As we talk about COVID-19 in Illinois, about the outbreaks, positivity rates, and regions heading in a worrisome direction, please remember that what we are ultimately talking about is people. Public health's entire goal is to help people and prevent people from becoming ill, being hospitalized, placed on a ventilator, getting seriously ill, and even dying. Everything we do is to help protect the health of families, friends, and loved ones from COVID-19. When we start talking about mitigation efforts and what cities, counties, businesses, health officials, and others should be doing, which is all critical and has to be done, we can readily lose sight of why we are doing these things. It is to protect people from a potentially dangerous and even deadly disease. And we have started seeing the number of people with COVID-19 increase, as the governor has just stated. Today we are reporting 2,128 newly diagnosed with COVID-19 and 27 people with COVID-19 who have just passed. This brings the total number of individuals in Illinois to 238,643 and a total number of lives lost of 8,091. The Illinois Department of Public Health is reporting today approximately 32,751 COVID tests. While all results have been reported out to those tested, we are experiencing a minor tech issue in the data processing system that we use to report out tests publicly. And that is why this number is somewhat lower than the 40 and 50,000 tests we've been reporting previously. This is being worked on with urgency, and we expect that this will be addressed very soon. Now, I want to say something in closing to you about the upcoming holiday weekend. There are persons all over the state of Illinois that are dedicated to the service of public health in every county across the state. Listen to them, help others, and as we gather, we know, as the governor just stated, that the hand washing, the masking up, and the social distancing are very necessary. And so even our small, intimate family gatherings must look different than they did before, but can be every bit as rewarding, as important, and as enjoyable. So help us help one another, and let us make sure that when we are in social gatherings that are not too large, especially if they are small gatherings indoors, that we are also remembering to infuse these principles of hand washing, masking up, and social distancing. Thank you so much for your time. I want to introduce our good colleague, Dr. Bliesdale.
I want to thank the governor for having me here to comment. And I want to thank the governor and the Illinois Department of Public Health for their leadership, as they have done so many measures to help to protect the people of Illinois in decreasing the spread of the COVID-19 infection. I'm an infectious disease physician and a scientist, and I have cared for COVID patients. We have science that shows that face coverings and physical distance can slow the transmission of this infection. Illinois was one of the first states to implement the requirement for face coverings. And this helped slow the spread of the infection and allowed hospitals like mine, UI Health, to be able to care for all of our patients, not just COVID patients. And we've been able to resume normal activities because of the work of the Department of Public Health and the governor. We've seen some of our neighboring states that were slow to adopt this measure of face coverings, and they have not been able to slow the spread of the infection to the same degree here in Illinois. We do know that there are certain activities that are at high risk for transmission of the COVID-19 infection. In particular, these are activities that don't allow for physical distancing or masking. These are activities of eating together and socially drinking together. In particular, in certain settings where you are bringing together a large number of people in restaurants, bars, or large gatherings, this is an opportunity for transmission at a vulnerable time when people have their masks down. In addition, if you have a community with high levels of positivity, meaning there are many people that are infected, there are probably many people that don't know that they're infected, this increases the number of people that will be at an event or at a restaurant or at a bar that will likely be infected, and then increases the number that can secondarily be infected, and then can lead to ongoing positivity within that community. Minimizing the number of individuals in a setting, requiring them to be seated, will not completely decrease transmission of the COVID-19 infection, because there is still risk. However, minimizing those numbers will decrease the number of people that are exposed. When you dine with someone you know, there is still risk. However, when you dine in a large setting with multiple people you don't know, this can also present further challenges for us and for the Department of Public Health. Because contact tracing for a group of people that you don't know who you were in contact with can create a delay in the notification of a potential exposure, and someone could develop symptoms and then have secondary transmission beyond that. Decreasing density, because there are many unknown contacts, can help us to mitigate the transmission. And again, many people think that dining or gathering with people they know, as many people may be considering for this holiday weekend, it does not decrease the risk. The mitigation strategies that the Department of Public Health and the governor are putting in place will help to decrease some transmission within communities of high activity, but it's something that we all need to continue to work on, and what we've done. You need to make sure that you're wearing a mask, even with people you know, because they're outside of your household, and it is an opportunity for transmission. Maintain that distance, maintain your face coverings. These measures are not insignificant. Dining and social drinking and gathering are part of our culture and much needed activities as we have been isolated for much of 2020 during this pandemic. These have been necessary requirements. And right now, when there is areas of higher activity, we will see increased hospitalizations, and then secondarily, we see increased deaths, as we've seen in the other states, as the governor has mentioned. It's important for us to use these tools to target at-risk communities to preserve our hospital capacity and to protect those that are vulnerable for complications from the infection. This is temporary. And with measured metrics, much like we had to move along the phases to phase 4 and phase 3, these are measured metrics that will help us to eventually open back up in certain areas as there is decreased transmission within a community. This, partnered with testing, can be very effective. We may see somewhat of a seesaw back and forth of opening activities and closing activities, but this is really important until we get an effective vaccine and treatment. At UI Health, we have been part of trials for treatment and started trials for vaccine, but we're not there yet. We don't have an effective vaccine or treatment to help to control the spread, and so these other measures are vitally important. Again, these target measures of at-risk activities where your mask is down and you cannot distance are vitally important to allow us to keep other activities open, other businesses, schools that are in session instead of virtual. This is a challenge to our culture. Sharing a meal, sharing a drink are ways of networking, connecting, sharing attention and affection. But as we're designing and redesigning many of our activities and our young people are learning how to learn virtually, we need to find alternative ways to share and connect and communicate with others until we have effective vaccines and treatment. Thank you, and then I will introduce Dr. Sulakis next.
Thank you, Dr. Bliesdale. And thank you, Governor Pritzker, for giving me this opportunity to give this update. My comments will be brief. Hello, my name is Nicholas Sulakis. I'm an assistant professor in the Department of Preventive Medicine at Northwestern University Feinberg School of Medicine. Since March, I've lent my expertise to the Illinois Department of Public Health to help develop and grow the Illinois Contact Tracing Collaborative. Today, I'll be giving an update on Illinois bars and restaurants. To start with some epidemiologic context, Illinois is trending upwards in an increase in new cases, which is to be expected given the easing of restrictions under Phase 4 of the Restore Illinois plan. Currently, counties, large and small, urban and rural, are seeing rising numbers. In the past month, 75 of 102 counties and 5 of 11 COVID regions have set new 7-day maximums for confirmed active infections. 30 counties are currently at a warning level, and 2 regions are under enhanced mitigation efforts to interrupt the spread of COVID-19. Throughout the pandemic and up until this critical juncture today, all 97 local health departments across the state investigate confirmed cases, which often results in identification of close contacts. Working in collaboration with our local health departments, the Illinois Contact Tracing Collaborative tracks clusters and outbreaks of COVID-19 in various settings to spot statewide trends. In the past 60 days, we have observed in excess of 1,400 cases and contacts associated with bars and restaurants. While most frequent in urban and suburban areas such as Chicago, the Collier counties, Champaign-Urbana, and St. Louis metropolitan areas, local health departments have documented cases and contacts in over 46 counties. We observed in the past 2 weeks a single outbreak of at least 14 cases, most likely associated with student return to college campus and renewal of social activity. While 2 regions have enhanced mitigation measures, many communities across the state continue to provide safe, well-distanced dining experiences. However, as temperatures cool, we will lose the luxury of outdoor dining and well-spaced seating, which make many of those dining experiences possible. Because bars and restaurants are for gathering, drinking, and eating, people will remove masks and stay for enough time to enjoy their meal or refreshments. Now is a good time to think ahead and begin reinforcing prevention strategies to reduce and eventually stop community transmission. Public health experts agree this virus spreads easily and there is potential for substantial asymptomatic spread in close quarters. While many of us visit establishments to see old friends and well-known acquaintances, possibly an equal number of us visit purposely establishments to meet new people from unknown places, often in close contact and with loud and jubilant talking. These situations present 2 different models of spread. We all enjoy bars and restaurants, and to continue enjoying them into the winter months, let's take time to reinforce what we know works. Washing or sanitizing our hands when we enter and exit establishments. While gathered, maintain physical distancing from other patrons, and make sure you mask up if you have to talk loudly. Restaurant owners, let's make allowances for sick employees to fully recover, maintain healthy operations, and promote behaviors that reduce spread among our employees and customers. Both the Department of Commerce and Economic Opportunity and the CDC offer plainly written, easy-to-follow guidance that keep us safer here in Illinois. Lastly, to the 25,000-plus restaurant owners across the state, we, the Contact Tracing EPI team, thank you for your continued engagement in promoting and protecting the health and safety of your customers and staff. We know it does not come without a cost, as do your customers, so again, we thank you. And with that, I'd like to turn it over back to Governor Pritzker for questions and answers.
Thank you, Dr. Sulakis, and happy to take any questions from members of the media.
Governor, nice to see you.
Good to see you. You're back.
Yeah, I
Yes.
We'll come back to this, the college campuses, after you have a chance to address that one.
Sure, thank you. I am very concerned, as I was back in the 4th of July weekend, that people will be gathering, as they often do, picnics, backyard barbecues, gatherings. And we know that much of the spread that's occurring in Illinois is actually happening in these settings. They're not public settings, they're often private settings. And people often let down their guard thinking, well, I'm at home or I'm at someone's home that I know. But the reality is that you don't know where everybody that's there has been. And unless you maintain social distance and are mindful about wearing masks, the reality is that there can be and has been significant amount of community spread as a result of those kinds of gatherings. So I do want to heighten everyone's awareness that just like every other day when I tell you, wear your mask, keep social distance, wash your hands, pay special attention though over this weekend, because you're going to be gathering with people where you're going to think you're going to let your guard down because they're people that you know. But just recognize that that's exactly where the community spread is occurring. And as was said, I think by Dr. Bliesdale, people who are drinking, eating, are not wearing their masks while they're doing that. And so you should pay special attention to maintain distance while you're doing that.
Whether this is for you or the doctors, we heard Dr. Fauci talking yesterday about this. The worst thing kids would do if the college kids get sick is to send them back home. What is your recommendation
Yep.
to parents here, and do you agree with the recommendation of Dr. Fauci?
Well, I am far be it for me to disagree with Dr. Fauci on what's best for lowering the spread. I agree wholeheartedly that colleges and universities, many of them, have actually cleared out a dorm on campus where people can go to either isolate if they don't know if they have it, or if they do have COVID-19, to isolate at the dorm in order to recover and be cared for on campus. So I would recommend to colleges and universities that they take special care, that they not just send somebody who may be sick directly back home, but rather do everything that they can to help them while they're on campus, to keep them on campus, and to provide a place for them to isolate.
Governor, was there such discrepancy between, like, ISU is having more than 1,000 cases, University of Illinois is not? There does seem to be such a wide discrepancy of what's going on those college campuses.
Sometimes I can't tell you the answer to why the difference between one campus and another. We've seen that in Iowa, for example, there are many more cases on campus, and part of that, of course, is they have a very, very high positivity rate in the state. I think it's now approaching 20% in Iowa. And I don't know what mitigations they'll put in place, but I will say that on our campuses in Illinois, I've been very clear that we need to make sure that people are focused on testing, that we've got a plan on each campus, and that where there are kids who, are sick or are suspected to have COVID-19, that there's a way to isolate them. And the universities, I have to say, are working very hard to do the right thing. The University of Illinois, I think, started a little bit earlier over the summer with requiring masking, putting on the student cards that they can't get back into their dorm unless they've been tested, or into the school buildings. And I know that that's something that other universities are working on too. Yeah, Amanda. Hi, good to see you.
May I ask, what input have you received from members of the Restore Illinois Commission, if any?
In the General Assembly?
In the General
Yeah.
Assembly's Restore Illinois Commission?
Yeah, lots of input, actually. Indeed, I have spoken with some of the co-chairs, individual members, and of course, members of my administration have gone to their hearings and provided feedback for them or answers to questions that they may have.
Can you respond to legislators that say that commission is barely met, particularly Republicans feel as if their suggestions aren't being taken into consideration, still with your administration, but also even within the commission, that it's perfunctory, rarely met?
It's a legislative commission, created commission, and we're providing the information as we receive it, indeed, virtually every day from lots of members of the General Assembly, including especially members of that commission, we get questions into our legislative staff. And so, I can tell you, because I speak with our legislative staff very frequently, that we're answering those questions literally daily and sending out emails to the entire General Assembly with answers to questions, because really the questions that many people ask in that commission are the same questions that other members of the General Assembly have.
And the media. As for another
Indeed.
legislative committee, I think occurred just before this event took place, but there's going to be a special investigative committee looking into whether Speaker Madigan should be disciplined or removed from the House. I know you have said that you are waiting to see if the allegations are true. Can you comment as to your support or lack thereof for this committee, and whether you believe that that will perhaps change and give you more definitive responses to his conduct?
Well, Amanda, this is an extraordinarily important, endeavor that I think will, as I have said all along, there are questions that need to be answered by the Speaker. And perhaps the creation of this legislative committee will actually get some of those answers. So I favor more information, more transparency, and I encourage the Speaker and anyone that they may call to give the answers to the questions that this committee will ask. Look, this is something that the House of Representatives has a rule about. Any member can call for this, or group of members can call for this. I hope that there is not, this is not a political stunt. I hope instead that they're going to be seeking real answers.
But is it wrong for Speaker Madigan to be so dismissive of this and to call it a political stunt and accuse Republicans of just trying to create a distraction?
That's his opinion. I want to hear the answers.
At the same time, it is an election year, obviously, and he believes that this is just more fuel for the election of divisiveness.
Oh, sure. I mean, I look, everything within the zone of an election, as you well know, because you cover it every year, every 2 years, is, everything seems to become hyper-political. But again, there are legitimate questions, and I've said that I believe that the Speaker needs to answer those questions. Very important.
Tomorrow, Vice President Biden will be going to Kenosha and visiting the president there as well. Kenosha has become such a flashpoint. Would you go visit there? And what would you do if you were asked to be a part of that?
Well, what I would say is I wouldn't do what the president did yesterday. That is to say, I believe that the goal should be healing. The goal should be listening. That's not what the president clearly was after. Talk about political stunts. That was a political stunt by the president. He ought to be listening to the concerns of people who have been discriminated against in the lack of police accountability. He ought to be listening to the concerns of people who want their community to be safe. And that's just not the way this president operates. He's looking for a way to sow division and to create some political issue that might get him reelected.
Do you have any thought to reopening physically IDES offices with continued issues there? There are those who say they want to be able to go into an office as they can other governmental offices.
So let me be clear that there are people working in those offices. So anybody who thinks that they're closed and people aren't showing up, that's not right. But the people who work at IDES have been receiving literally threats, directly and indirectly. And it makes it much more difficult to maintain their security when we open those offices physically. Having said that, there is an enormous effort by the new director to get in touch with everybody who may have an issue with their unemployment. As you know, the number of people who have received claims properly is over 1.2 million, and IDES actually has done a lot of work to make sure that those people who haven't, because there may be an arbitration that's required, or because there was some difficulty in their past that caused them not to get renewed benefits this time that they're looking for unemployment. Those challenges, right, those specific cases are being looked after by lots of staff. We've added, as you know, hundreds, indeed, it's I think more than 600 now in our call center to make sure that we're getting to call back everybody that needs a call back. So there's a lot of work being done, and I do think that we have to worry about the security of the people that are working in those offices and be responsive to the public.
All right, thanks everyone. That's the last one.
When you're saying there have been threats made to them, I haven't heard of that. What kind of threats?
You could Google. I mean, there have been articles about threats that have been made. Yeah. I mean, it's been a real problem. Yeah. So thank you very much, everybody.
Thank you, Governor.